the value-based primary care delivery model. This model places emphasis on improving the health outcomes of populations, and it allows physicians to find unique and creative ways to respond to their patients' needs, preferences, and resources. So right now, and I don't want to get too advanced at this level, but basically right now, family medicine physician offices are reimbursed for their services based on the number of people they see. And the problem with that has been that during like the COVID pandemic, for example, at a time where people really are not able to get to the doctor because maybe they don't feel it's safe to go. Maybe they lost their job, and then because they lost their job, they no longer had their employer based health insurance. They didn't have a way to really access the healthcare system. That actually drove down reimbursement for the physicians. And then there are many family medicine practices that actually had to either lay off staff, or some of them unfortunately had to close altogether, which means that patients are without any form of health care because of it. So with the value-based care model, we're basically reimbursed on the quality of care that we deliver to our patients. How well are we controlling our patients' diabetes? How well are we controlling their high blood pressure? And we can, how we service the patient, how we get that done, we have a little bit more discretion. So for example, if it happens to work better for a patient that many of their visits are done over telemedicine, for example, they are able to come to the office maybe a couple times a year, but maybe because of their work schedule, it might be better for them to actually have a few telehealth visits in between in order to get their diabetes under control. The value-based care model allows us a little bit more leeway to do that. And also we can be a little bit more flexible in terms of maybe even being able to get additional access after hours and things like that for patients. So that's one thing that I hope that the whole field of medicine can do, but particularly family medicine, because we're on the front lines. And the more that we can really serve our patients based on their needs and their preferences, then the better we're going to be able to make their health.